Some people in their 80s reportedly encountered difficulties accessing the free healthcare services offered under the Golden 80 Health Package. One frustrated citizen called into Let's Talk Law on Radio 100 Friday morning, expressing concerns about her 91-year-old father's experience when trying to get treatment at a community wellness center.
The caller said that they took her father to the health center and they wanted a letter from the ministry or from whoever, of a letter of exemption, so that he did not have to pay the requisite fee. And we are of the view that this program should be, at least clarified and made a lot simpler, so that persons should only be required to show their ID card to prove that they qualify for whatever exemption it is, and not to go and get a letter. Imagine your father falls sick on a Sunday. What ministry are you going to go to on a Sunday to get that exemption letter to show wherever you're going to bring him?
That was Let's Talk Law co-host Veronica Bernard speaking to Health Minister Moses Baptiste, who joined the program to clarify the situation.
The 80 Plus program can be accessed at all our health and wellness centers throughout St. Lucia. The hospitals are not yet on board, and we did make that statement very early on. The hospitals are not yet on board because we are working with the hospitals to clarify the financials for the 80 Plus. But all the wellness centers, including the Grocery Polyclinic, these centers are on board. So when anybody who is 80 years or over, they simply need to show their ID card.
Launched July 1st, 2023, the Golden 80 Plus Health Package offers free medication, hearing and eye care services at community wellness centers to nationals 80 and older. Health Minister Moses Baptiste acknowledged minor issues and called for further training of community-level health providers.
We have had situations before where maybe someone goes to the wellness center or to the grocery polyclinic and the services were not provided. And we do admit that in some cases, either the clarification to the staff and so on, some work needs to be done there. And we are still trying to tidy up and tighten the program. But there is no need for an exemption letter to access the services.
Attorney-at-law Andy George admonished officials writ large for their lack of coordination and poor communication.
May I just indicate that is most unfortunate that such an important policy may have been adopted and the various agencies involved are not aware. It shows there is a deficit of communication, of the transmission of communication among the agencies, and that should never happen. And I urge you, I implore you to do everything in your effort to ensure that doesn't happen, because a life may have been lost as a result of this lack of proper communication, which is ever present in many departments in St. Lucia. It's not just the health care services. It is in my business, the legal profession. We have a problem with our land registry. We can't get documents that should take 2 weeks. We can't get them in 6 months. I mean, there needs to be an overhaul, an understudy of all the various government departments.
The healthcare system, like many others, has been impacted by international supply chain issues affecting the availability of some medications. The Ministry of Health is working to address these challenges and improve service delivery for patients.